What if I told you that the medication sitting in your cabinet right now, the one your doctor prescribed, could be quietly stealing your memory? Not in years, not gradually, but rapidly. Today, I'm going to reveal 9 popular medications that research has directly linked to rapid cognitive decline and dementia. And one of them is so common, millions of people take it every single night before bed. Stay with me until the end, because medication number 7 is something almost nobody talks about, and it could be affecting someone you love right now. I'm Dr. Andewala, and my mission is to give you the truth your doctor may not have time to tell you. If you care about your brain health, hit that like button and let's get started. Intro CTAO 30045. Before we dive in, if you haven't already subscribed to this channel, do it right now. Every week I cover critical health topics that could save your life or the life of someone you love. And make sure you watch this entire video. I'll share what you can do to protect yourself at the very end. Intro Segmento 45130. Dementia is one of the most feared conditions in the world. Over 55 million people globally are living with it right now. Most people believe it's simply caused by aging or genetics. But here's what the latest research is making very clear: the medications we take every single day may be dramatically speeding up cognitive decline in ways doctors are only beginning to fully understand. We're not talking about rare or experimental drugs. We're talking about medications prescribed millions of times each year for anxiety, heartburn, sleep, allergies, and even depression. The scary part? Many of these cognitive effects are mistaken for normal aging. So people keep taking the drug, the brain keeps declining, and nobody connects the dots. Medication number 1, benzodiazepines 1, 33 o'clock. Number 1 on our list, benzodiazepines. You may know these by their brand names: Xanax, Valium, Ativan, Klonopin. These are among the most widely prescribed drugs in the world, used to treat anxiety and insomnia. And on the surface, they seem harmless. You feel calmer. You sleep better. What's the problem? The problem is what's happening inside your brain. Research published in peer-reviewed journals has shown that long-term use of benzodiazepines is strongly associated with an elevated risk of Alzheimer's disease and other forms of dementia. These drugs work by enhancing a chemical called GABA, which slows down brain activity. Over time, this suppression doesn't just calm you, it starts to impair memory formation at a fundamental level. Studies show people who take benzodiazepines long-term experience anterograde amnesia, meaning the brain loses its ability to form new memories. And the longer you take them, the deeper the damage goes. If you or someone you love is on a benzodiazepine, this is a conversation you need to have with your doctor immediately. Medication number 2, anticholinergic antihistamines 300 Number 2, first-generation antihistamines. Think Benadryl diphenhydramine. Millions of people take this drug for allergies, cold symptoms, or as a sleep aid. You can buy it over the counter without a prescription. It seems completely safe, but the science tells a very different story. Diphenhydramine is what's known as an anticholinergic drug. It works by blocking a neurotransmitter called acetylcholine in your body. Here is why that's terrifying. Acetylcholine is the primary neurotransmitter responsible for memory and learning. When you block it, you interfere directly with the brain's ability to store and retrieve information. Research shows that cognitively normal people taking at least one strong anticholinergic drug were 47% more likely to develop mild cognitive impairment, a precursor to dementia, over the following decade. 47%. That's not a small number. That's nearly half. And yet millions of people pop a Benadryl every night thinking it's harmless. Medication number 3, bladder control drugs 43545. Number 3, bladder control medications. These include oxybutynin and tolterodine, common prescriptions for overactive bladder. This is a condition that affects millions of older adults, so these drugs are incredibly common. And they are also packed with strong anticholinergic properties. Just like Benadryl, these medications block acetylcholine throughout the body, including in the brain. Long-term use has been directly linked to confusion, memory lapses, and accelerated cognitive decline. Studies have found that patients using bladder antimuscarinic drugs faced a significantly higher risk of dementia diagnosis over time. What makes this especially dangerous is that these drugs are prescribed to older adults, the very population most vulnerable to cognitive decline. If you or a family member is taking oxybutynin or a similar drug regularly, please speak with a healthcare provider about alternative treatments or safer options. Medication number 4, tricyclic antidepressants 5:45 7 o'clock. Number 4. Tricyclic antidepressants. These include medications like amitriptyline, nortriptyline, and doxepin. They've been used for decades to treat depression, nerve pain, and even migraines, but they carry serious hidden consequences for the aging brain. Tricyclics are among the most potent anticholinergic medications in existence. Their blockade of acetylcholine is aggressive and widespread. Research has consistently shown that long-term use leads to confusion, memory impairment, and a measurably increased risk of dementia. Studies confirm that anticholinergic antidepressants are directly associated with cognitive decline. The cruel irony here is profound. These drugs are prescribed to treat depression, which itself is a risk factor for dementia. But by taking them long-term, a patient may inadvertently be accelerating the very cognitive deterioration they're trying to avoid. Newer antidepressants often carry far lower anticholinergic risk. Ask your doctor if a switch is possible. Medication number 5, sleep aids Z-drug 7-00815. Number 5. Non-benzodiazepine sleep aids known as Z-drugs. These are Ambien, Lunesta, and Sonata-zolpidem, Esipiclone, Zalplan. They were marketed as a safer alternative to benzodiazepines for sleep, but the research is increasingly alarming. Studies show that long-term use of Z-drugs is associated with memory problems and a measurably increased risk of dementia. One study found that elderly patients who used zolpidem derivatives had a significantly increased risk of developing reversible dementia. These drugs affect the same GABA pathways in the brain as benzodiazepines and carry surprisingly similar long-term cognitive risks. Here's the real danger. Sleep problems are extremely common in people who are in the early, undetected stages of dementia. So doctors prescribe sleeping pills for the symptom, not knowing the medication may be accelerating the underlying disease. If you rely on a Z-drug nightly, explore cognitive behavioral therapy for insomnia as a proven, drug-free alternative. Medication number 6, antipsychotics 8-15-930. Number 6. Antipsychotic medications. Clozapine, olanzapine, quetiapine. These drugs are used to treat schizophrenia, bipolar disorder, and are increasingly prescribed off-label for anxiety, depression, and sleep in older adults. And this off-label use is a serious concern. Antipsychotics have significant anticholinergic activity and also affect dopamine pathways deeply. Research has shown that antipsychotic use, particularly in older adults, is associated with accelerated cognitive decline and increased dementia risk. These drugs can induce a state of sedation and cognitive blunting that mimics and may genuinely worsen early dementia. What's more troubling is that antipsychotics are sometimes prescribed to dementia patients to manage behavioral symptoms, and the evidence shows this can make cognitive decline worse, not better. Multiple regulatory bodies have issued black box warnings about antipsychotic use in elderly patients with dementia-related conditions. Yet prescriptions continue at a high rate. Medication number 7, proton pump inhibitors 9-30-1045. Number 7, and this is the one I promised you, proton pump inhibitors, or PPIs. Omeprazole, Nexium, Prevacid, Prilosec. These are the heartburn and acid reflux medications taken by hundreds of millions of people worldwide. And many people take them every single day for years, sometimes without even being monitored by a doctor. Here's what the research shows. Long-term PPI use has been linked to cognitive health decline through multiple pathways. First, PPIs may interfere with vitamin B12 absorption, and low B12 is a well-established cause of cognitive impairment. Second, and even more alarming, research suggests PPIs may alter the pH of brain cells in ways that promote the accumulation of amyloid beta peptides, the same toxic protein plaques found in Alzheimer's disease. A study published in JAMA Neurology found an association between PPI use and risk of dementia. If you've been taking a PPI daily for months or years, talk to your doctor about whether you truly still need it. Often, lifestyle modifications, dietary changes, weight loss, eating habits can control reflux without the long-term brain risk. Medication number 8, opioid pain medications 10-45-12 o'clock. Number 8, opioid pain medications. Oxycodone, hydrocodone, morphine, tramadol. These are prescribed for chronic pain, post-surgical recovery, and cancer care. The opioid crisis has brought enormous attention to addiction, but far less attention to what opioids do to the aging brain. Research has shown that prescription opioid use is associated with an increased risk of dementia and cognitive decline. A prospective cohort study published in the Journal of the American Geriatric Society found that opioid users had measurably worse cognitive outcomes over time. These drugs affect multiple neurotransmitter systems, promote neuroinflammation, and can disrupt the brain's critical overnight memory consolidation process by suppressing deep sleep. Chronic pain itself is a risk factor for cognitive decline, so the relationship is complicated. But the key issue is this: if opioids are being used long-term for pain management, the cognitive consequences must be weighed alongside the benefits. There are pain management strategies that carry significantly lower brain risk, and they deserve serious exploration. Medication number 9: corticosteroids 12-0013-15. Number 9. Corticosteroids. Prednisone, methylprednisolone, dexamethasone, prescribed for inflammation, autoimmune conditions, asthma, arthritis, and more. These are some of the most commonly prescribed drugs in the world, and almost no one talks about what they do to the brain. Long-term or high-dose corticosteroid use has been linked to structural changes in the hippocampus, the brain's memory center. Corticosteroids elevate cortisol levels dramatically, and chronic high cortisol is one of the most neurotoxic conditions the brain can face. Research shows glucocorticoids can cause hippocampal atrophy, literally shrinking the memory center of the brain. Multiple drug classes, including corticosteroids, have been associated with increased risk of cognitive impairment when used long-term. If you require steroids for a chronic condition, ask your doctor about the lowest effective dose, steroid-sparing alternatives, and regular cognitive monitoring. The brain damage from long-term steroid use can be progressive if left unaddressed. What you can do: protect your brain. 13, 15, 14, 30. Now, and this is critical, I am not telling you to stop your medications. Never stop a prescribed medication without speaking to your doctor first. What I am urging you to do is to become an informed, proactive patient. Knowledge is your most powerful protection. Here is what I recommend. First, review your medication list with your doctor, specifically through the lens of cognitive risk. Ask, is any drug I'm taking an anticholinergic? Is there a safer alternative? Second, avoid long-term use of any medication without regular reassessment. Many people stay on drugs for years simply because no one reviewed their prescription. Third, consider non-pharmacological alternatives wherever possible. Cognitive behavioral therapy is as effective as sleeping pills for insomnia and carries zero brain risk. Dietary changes can often replace long-term PPIs. Exercise reduces anxiety with benefits no pill can match. Fourth, get your vitamin B12 levels checked, especially if you are on PPIs, metformin, or are over 60. Fifth, if you are caring for an elderly parent or loved one, go through their medications with a geriatrician or clinical pharmacologist. Polypharmacy: taking multiple drugs simultaneously dramatically multiplies cognitive risk. Many older adults are taking 5, 7, even 10 medications at once. Each one adds to what researchers call the anticholinergic burden on the brain. Outro and final: CTA 14, 30, 15 o'clock. Your brain is your most precious asset. It is the seat of everything you are: your memories, your relationships, your personality, your independence. Do not let it be silently damaged by a pill that was supposed to help you. Share this video with every person you care about. This information could genuinely change or save someone's life. If you found this video valuable, please give it a like right now. It helps this life-saving information reach more people who desperately need it. Subscribe to Dr. Andewala for more honest, evidence-based health content every week. And drop a comment below: which medication on this list surprised you the most? I read every single comment. Until next time, protect your brain, question your prescriptions, and take charge of your health.